right. So once again, Erica, thank you so much for joining us today, and we truly appreciate your time. And like what I've said, this will just be short, informal conversation. There are no right or wrong answers. We just want to capture your real experience working with DocVA. So, Erica, just please introduce yourself by sharing your full name, your role, the type of practice or specialty that you're in, and your location, please.
Okay, my name is Erica Humbert. I'm a nurse practitioner, and my practice specializes in weight loss and hormone replacement therapy primarily. But I have a background in primary care, so I do a lot of primary care with my patients as well. And I'm located in Green Cove Springs, Florida, which is just outside of Jacksonville, Florida.
Wow. Good. Thanks for sharing, Erica. So, I would like to know before working with DocVA, what challenges or pain points were you experiencing in your practice or operations?
So really, as I started to grow, I was getting more and more messages from patients and more calls from new patients wanting to join the practice. And I was in that place where I thought I could manage it all. And I was just trying to answer all the messages and all the phone calls and see the patients during the day. And all of my work days were stretching into 12 hours. And I was very stressed and I was missing some of those calls. So there were new patients wanting to be seen that were not even able to get in. So at first I was concerned. I didn't know if I could afford to hire a VA, but the truth was I could not afford not to. So really, I know that it's gonna lead into our next question, but when
Mhm.
I was able to bring on my VA, the calls got captured, the new patients got scheduled, the messages were answered, and now I was not only getting my time back, but I was able to generate well over the revenue that it cost me. So it really helped me grow, and I don't think I would have grown without
Oh,
him.
wow. Thank you so much for that, Erica. That's just so satisfying to hear. So, what specific tasks do your virtual assistant handle in your practice or business today?
This is a great question. So I did not know at first what a VA could handle. So I really just started out with asking Enrico to answer phone calls that come in, schedule patients, reschedule them. But then I just grew into asking for more things to be done, and everything I've asked him, he has mastered. And actually, excitingly for me, he often knows how to do a task more efficiently than I do. So for one example is that I ask him to check on the labs that are coming into my fax inbox and attach those labs to the chart. And previously, the process I was using to look at the labs, attach them to the chart, review them, it was taking way too long. And he was able to show me a more streamlined way of attaching those labs to the chart. So he not only answers the calls and schedules the patients, but he also brings in any documents that come into the practice, attaching them to my medical record system so that I don't have to do that. Then he notifies me that they're there so I can review them. He can call pharmacies for me if I let him know, hey, I need this pharmacy called because there's a question about a medication that just needs clarification, simple things like that. He can make those phone calls that were taking up like 5 and 10 minutes for each task, but those added up to hours of my day. So he's able to handle those really efficiently so that, and then bring those things to my attention that I need to focus on clinically. So it's been revolutionary for me because I didn't really know what all he could do, but each thing I've brought him, he's been able to do it and probably better than I would have done it anyways, which frees up my time. It's really, really good.
Wow, Erica, thank you so much for sharing that. So, now, why would you recommend DocVA to your colleagues or peers based on your experience?
That's a great question. So when I reached out to DocVA, I was just kind of lost. I didn't really know how to hire a virtual assistant. What does that entail? What can a virtual assistant do for me? And really, through a couple of quick phone calls, they were able to not only answer my questions about that, match me with some potential candidates, give me an opportunity to interview them, and help me pick the best one. But anytime I've had questions about whether I want to give my VA a bonus, how do I handle anything administrative, they've answered me right away. So they really just helped me do this seamlessly, really taking like, I was an overwhelmed practice owner that only knew the medical side, not the administrative side so much. And DocVA handled the administrative side for me so I could focus on working with my VA and treating my patients. So it's definitely, I would definitely recommend it to any provider because DocVA specializes in VAs that handle medical practices. So if I wanted to just look for a virtual assistant anywhere, they may or may not have that medical knowledge on working with a medical system. So that's really particularly beneficial. But just really, they handle the helping me hire, which I had no idea how to do anyways, and the helping me of like how to deal with anything administrative involving like paying my VA and taking care of administrative things.
Wow. Thank you, Erica. And once again, thank you for your time and for sharing your experience. Your feedback helps other practices make informed decisions, and we truly, truly appreciate your partnership with us.
I'm Sam. I truly appreciate your organization and everything you've done for me. I truly will not would not have grown my practice without DocVA, and I would not have made the impact on the lives of the patients. So the amount of people and that have been impacted just by my ability to work with Enrico has been phenomenal. I'm super, super grateful and happy.
Wow. Thank you once again, Erica, for your time today. You enjoy the rest of the day. You take care.
All right, you too. Thank you.